Hi everyone, my name is Siobhan. I'm a student physical therapist at Regis University. It is a beautiful day here in Colorado, and I'm here to give you a little snapshot of how I explain pain. By definition, pain is an unpleasant sensory or emotional experience associated with actual or potential tissue damage or described in such terms. The term itself, pain, often has negative connotations, but in reality, pain is a universal human experience. And our own experience with pain often allows us to empathize with others and therefore can be a necessary aspect in building relationships. Also, pain is our body's way of protecting us. It's telling us that there's a threat or danger to our body, and pain is sensed when the brain receives and perceives that threat. I also want to state an important fact that pain is real and it's always a subjective experience. So, pain is psychosomatic, meaning it's regulated by our brain. And what does this mean? So, simply put, our body has nociceptors, what we call our pain receptors, that are free nerve endings located all over the body, including our skin, muscles, joints, bones, even our internal organs. And nociceptors play a crucial role in how our body feels and reacts to pain. The main purpose of these nociceptors is to respond to damage or what we perceive as a threat to the body by transmitting signals to the brain and spinal cord. So, for example, when I stub my toe, which for me happens often, nociceptors are activated, which then sends a signal to the brain via peripheral nerves. These transmitted pain signals are very complex. They carry information about both the location and the intensity of that painful stimuli. So, this way, your body can fully process that pain and eventually send communication back to hopefully block further pain signals. And these pain signals fire in response to all types of pain, whether that be dull, sharp, mild, and can even sense how long we've been feeling that pain. So, when we're experiencing pain for a couple of days, a couple of weeks, this is what we call acute pain. This is really common with tissue damage, for example, when you sprain your ankle playing soccer, again, like I do often. In this scenario, your physical therapist will enable that tissue healing process, and you'll work together to create a plan that encourages you to stay active while finding tools to manage your pain while that tissue is healing so that you can get back to your daily activities and your hobbies. When pain persists for a bit longer, 3 months or longer, you're now experiencing chronic pain, or what we call persistent or chronic pain. And in this case, the tissue damage is not the primary concern, as it's rather the brain that's continuing to produce feelings of pain even after the tissue damage has been resolved. So, this is a combination of both physical and physiological and psychological input with tissues and the environment, both playing a role in this pain that you're feeling. As a future physical therapist, I like to remind myself that everyone learns the meaning of pain through experiences usually related to injuries or painful events earlier on in life. And we tend to have even a personal and or cultural meaning of pain, and that'll inform our pain experience moving forward. So it's important to have transparent dialogue between a provider and a patient. And as a patient, feel free to ask questions and verbalize your preferences and needs. For myself as a healthcare provider, I want my patients to feel confident in knowing that they're in a safe space to have this discussion. And generally speaking, as physical therapists, our goal is to demonstrate to our patients that you are capable of activity participation even when you're coping with any type of pain. We will teach you cognitive strategies that include problem solving, goal setting, and increasing self efficacy. My last note will be that the perception of pain can often be retrained. So, a few tips just to start: you can address stressors that may be contributing to your pain in your daily life. Also, you can exercise. And appropriate and functional exercise will ultimately calm down the nervous system and will improve your mood as well. Lastly, your physical therapist will be there with you every step of the way. Thanks for listening.